So we'll get started. My guest is Becky Marval. Instead of me introducing you, maybe just quickly tell us a little bit about yourself.
Thanks for having me here today. I am an occupational therapist by trade, and in the last couple of years, I've taken over the role of lead for the MOSH team, Mobile Outreach Street Health. So MOSH started in 2009, and as a bit of a solution or an attempt to address some pretty significant health inequities in terms of folks accessing healthcare who are homeless and street involved in our community. And so the team does primary health care. So it's the same kind of thing you might get, say, at a nurse practitioner or a family doctor's office, plus, so because we're doing a lot more of the wraparound care and we're taking a bit of a different approach. We're part of the North End Community Health Center, which has been around for quite some time. We're celebrating the anniversary this year. And yeah, we really just are trying to help bring healthcare where people are in terms of folks who otherwise aren't accessing it due to the complexity of their lives related to homelessness and street involvement. There are quite a few barriers that people can encounter. And when I'm talking about health inequity, I'm talking about a pretty significant difference in terms of any kind of illness, disease, injury, and even death that people who are homeless would experience compared to, say, folks who are not homeless. And some of that relates to access to healthcare. A lot of it relates to larger issues like poverty and homelessness and racism and lots of other things that are playing into this. Barriers can be institutional in terms of people's experience of navigating systems that are not necessarily built to be user-friendly or built to be user-friendly for a certain demographic. And so for all these reasons, accessing mainstream healthcare can be difficult or impossible for some folks. And then not to mention how the structure is set up such that you really have to be quite organized and sometimes persistent and capable to be able to get to those appointments or to get the care or the follow-up that you need. And in our model, we're looking to directly impact that experience of access to healthcare by making it as accessible as possible, as low threshold as possible. So by doing outreach to where people already are spending their time. Typically in non-pandemic times, we have a set nursing schedule and the nurses visit our partner locations, say weekly or bi-weekly. And oftentimes it is using our mobile clinic. And other times it could be on foot to do street outreach, for example, and sometimes it's one-on-one work, and sometimes it's more systems level work and looking at the environment as one of the key variables that can be changed versus only looking at the person and say their behaviors as a way to improve health and wellness. I guess I should say really put a plug in for community health centers as another way forward is to try to promote this as a way of delivering healthcare when you're looking at community health. It's excellent and I think underutilized in this province. So a community, like a regular walk-in clinic, again, might just be a couple of physicians or maybe with a nurse. And a community health center model is really something that is meant to be a bit of a community hub for healthcare. And so, for example, at our community health center, it was originally built to serve folks of African descent in the Gottingen area. There was this real gap in inequity in healthcare, and so this was the community solution to addressing it, was to develop some sort of a healthcare center targeting healthcare practices for this community. And so the community health center model is to kind of build around a need and tailor your services and model an approach to that need. We've got all kinds of different services because over the years, we just follow the need and look at the social determinants of health. We're unique in our scope. And as we said, we've got this history around being built around a community need that can be a little bit different than some of the other models that you might see in Nova Scotia. One of the ways that that's impacted us is in a shift of priorities. And so we've been working closely with public health and with shelter providers and other partners to be able to do pandemic planning and figuring out at first how to support our community in being able to adopt whatever prevention methods they can, given their very unique environments, like being able to, physically distance in a shelter that is a very different experience than being able to do that at home. We also did kind of more frontline shift. So everything from the asymptomatic swabbing, targeting our populations, to a lot of the contact tracing, the pieces that public health nurses may have taken over for the general public, but we were in a better position to do based on those relationships and expertise that we had related to the folks that we had worked with over the past decade plus. As vaccine rollout has occurred in our community, we also had an opportunity to be able to deliver the vaccine in partnership with public health, and we're looking to offer the vaccine rollout in really tailored ways so that we can reach the folks that we're seeing who very likely would not otherwise be able to access a regular vaccine clinics. And some people are on the street homeless, and perhaps more now than we have had in previous years. So the landscape has changed, and so we too had to change how we deliver the care. I think a key place to begin would be for decision makers and planners to take interest in and engage the community in which they're serving. So opportunities like this to raise awareness around what who the stakeholders are in the community is important, and then what the perspectives are. At times, going directly to the source for folks with lived experiences is another important avenue to gather information about how best to plan in an inclusive way. And otherwise, looking at concerns related to defensive design are really affronting folks who are homeless and street involved. Like when cities plan to keep people out and keep people away, like that's really, I think, the opposite of what I would want to see happening. I think the opposite could be to look at more inclusive spaces and look at how we're using public spaces and investing in them and making it so that, not that we are trying to live with homelessness and that we shouldn't be addressing homelessness, but how can we create public spaces that are more supportive and facilitate wellness? And even regardless of that, from like a universal design point of view, if you create public spaces that function well for people who are homeless, they're going to function well for people who are just out and about trying to enjoy their lives. So to be able to access water and bathrooms and shade and internet is good for every citizen, and it's really necessary for folks when they have no private property to be able to access those things for themselves. So those would be some really important pieces that I would want decision makers to be considering. Certainly, MOSH and the North End Clinic would welcome financial support, as would the many other agencies who are on the front lines of homelessness. Like MOSH, the North End Clinic, and many shelters and many other serving agencies do rely on volunteer support, which has been trickier during COVID, of course, but please, whatever piques your interest, feel free to explore further. Raising awareness in your circles, wherever they might be, around some of the issues that you've heard about today. And if you do want to further educate yourself around them, to continue those conversations, make choices that reflect your values, if these are your values, in terms of elected officials and how you'd like to see our city and our province and our country develop over time is partly in your hands by how you make decisions, and whether it be social media or how you vote. So these are all ways that you can be an accountable citizen in trying to move health equity forward.
If you are interested in getting involved in MOSH, how should people reach out to you?
So you can, on Twitter, you can reach us at MOSH Halifax. You can look for us on our outdated website at moshhalifax.ca, or our North End Community Health Center website. It's nechc.com. And they also have a Facebook page that you can look for. So any of those ways are great. On the websites, you'll see contact information and forms for volunteering and that sort of thing.
All right. Thanks so much.
It's been a pleasure. Thank you.
Bye.